Imagine sitting at the dinner table with your child enjoying an ordinary family meal. Suddenly, your child starts coughing. Then the coughing stops. They cannot speak. They cannot breathe. In that frightening moment, would you know exactly what to do? Child choking can happen in seconds, and knowing how to recognize it and respond quickly could make a life-saving difference. Welcome to Happy Kids, Happy Parents, a channel dedicated to helping parents raise happy, healthy, safe, and confident children. In today's video, we're going to talk about what every parent and caregiver should know about child choking, how to recognize it, what to do, and most importantly, how to help prevent it. Choking happens when an object becomes stuck in a person's airway, preventing air from reaching the lungs. For young children, choking can happen while eating or when they put small objects into their mouths. Common choking hazards can include whole grapes, nuts, hard candies, popcorn, chunks of meat, and pieces of raw vegetables. Small household objects, coins, batteries, and toys that are not suitable for a child's age can also become dangerous choking hazards. That's why parents and caregivers need to stay alert. One of the most important things a parent can learn is how to recognize choking. If a child is coughing forcefully and can still speak or breathe, encourage them to keep coughing. But if the child cannot cough effectively, cannot speak, cannot breathe, or is making little or no sound, they may be experiencing severe choking. You may also notice the child becoming distressed, clutching their throat, or showing signs of difficulty breathing. Recognizing these warning signs quickly is extremely important. When a child is choking, panic can make the situation even more difficult. Try to stay calm and act quickly. If another adult is nearby, ask them to call your local emergency services while you help the child. If you are alone, follow your local emergency guidance and get emergency help as quickly as possible. Remember, every second can matter in a serious choking emergency. If the child is coughing forcefully, encourage them to keep coughing. Stay with the child and watch carefully. Do not give them food or drink while they are choking, and do not blindly put your fingers into their mouth to search for an object. If the coughing becomes ineffective, or the child can no longer breathe or speak, you need to act immediately. For a child experiencing severe choking who cannot breathe, speak, or cough effectively, first aid guidelines recommend giving back blows followed by abdominal thrusts. However, the correct technique depends on the child's age and size. For infants under 1 year, the technique is different. Back blows and chest thrusts are used instead of abdominal thrusts, because these techniques must be performed correctly. Every parent and caregiver should consider taking an accredited first aid or CPR course and learning these skills through hands-on training. Knowing what to do before an emergency happens can give you confidence when every second counts. If a choking child becomes unresponsive, place them on a firm, flat surface and call emergency services immediately. Begin CPR according to your training and follow instructions from the emergency dispatcher. If you are trained in CPR, continue until the child shows signs of life or emergency responders take over. This is one reason why learning child CPR and first aid before an emergency happens is so important. There are also things you should avoid. Never blindly sweep your fingers inside a child's mouth. Never shake or violently hit a child. Never try to force food or water down the throat. And never assume the danger has completely passed just because the object comes out. If the child received abdominal thrusts or chest thrusts or continues to have breathing problems, seek appropriate medical evaluation.
The best way to deal with choking is to prevent it whenever possible.
Always supervise young children while they eat. Encourage children to sit down while eating rather than running, playing, or talking with food in their mouths. Prepare food in an age-appropriate way. Some foods may need to be cut, softened, or modified to reduce choking risk. Keep small objects away from young children, and always check toys for age recommendations. A few simple precautions can greatly reduce the risk of a choking emergency. Remember, choking can happen quickly, but preparation can make a difference. Learn how to recognize severe choking. Know the appropriate first aid response for the child's age. Learn CPR. Keep emergency numbers easily accessible. And most importantly, never underestimate the value of prevention. As parents and caregivers, we may not be able to prevent every accident, but we can prepare ourselves to respond when our children need us most. Every parent wants to protect their child. Sometimes the most important protection is simply knowing what to do when an emergency happens. If you found this video helpful, subscribe to Happy Kids, Happy Parents for more practical information about parenting, child safety, emotional development, and first aid. Share this video with another parent, guardian, teacher, or caregiver. You never know whose knowledge or whose life it might help save. This is Happy Kids, Happy Parents. Happy kids, happy parents, stronger families. Until next time, stay safe and keep your children safe.